Rapid laboratory testing is needed to document any contraindications to TPA use, particularly the presence of a coagulopathy that might put the patient at higher risk of bleeding. Recommendations from the American Heart Association are that laboratory testing should be completed and the results available to the team by 45 minutes after arrival in the emergency room. That can sometimes be a challenge for some laboratories. The key test results to obtain are the coagulation parameters and the platelet count. There is some evidence that patients may be treated with TPA even before the laboratory test results have returned, as long as the suspicion for a coagulopathy is very low. So that would mean patients who are not taking anticoagulants, who do not have a history of liver kidney disease, do not have active cancer, do not have a history of alcoholism or illegal drug use. Studies show that these patients have an extremely low incidence of unsuspected coagulopathy on laboratory testing. And on a case-by-case basis, it may be acceptable to start TPA even before the serum test results are reported, as long as the test results are looked at as quickly as possible, and if any abnormality is found, then the TPA would be stopped. And this practice is supported by the guideline statements from the American Heart Association, and also supported by a number of single-center studies that now show very clearly that the incidence of finding an abnormality on the laboratory testing when it's not suspected in an otherwise healthy person is very low, and less than 1%. Another strategy that hospitals can use to get the critical laboratory results more quickly for patients who are taking warfarin is to use point-of-care testing to test the international normalized ratio, or INR, rather than using the hospital laboratory. So the point-of-care testing can be done at the bedside with a machine and can give results in a few minutes instead of the 45 minutes to an hour that it can sometimes take when going through the routine hospital laboratory. And that can be considered for patients who are taking warfarin, in which the INR needs to be documented before a decision about TPA can be made.